So good afternoon, and organizers. I thank the organizers for inviting me to demonstrate the process of continuous renal replacement therapy for this 15 kilo child who has hyperkalemia, metabolic acidosis and fluid overload. Today we have dedicated pediatric machines coming into use. They haven't yet come to India, so for us today the mainstay of our treatment still remains this machine, the PrismaFlex machine, which is capable of doing treatments both for adults, for children and also for infants weighing up to 8 kilos in weight. So let's switch on the machine here, and as the machine loads its software, this machine is got an 8.2 software version. I'm going to just have a look at the front facade of the machine. What we have here is we've got 5 roller pumps. This is the blood pump, the large one, which delivers blood from the patient to the hemofilter. This is the stand on which I will place the hemofilter, and here we have 4 pumps, and we have, this is the pre-blood pump, this is the effluent pump, this is the dialysate pump, and this is the replacement fluid pump. Over here we have the blood leak detector. We have, unlike in the normal conventional hemodialysis machine, we have pressure pods which have a strain gauge sensor type of action, and we have the effluent pressure pod here, we have the access pressure pod here, and we have the filter pressure pod here, and we also have one blood-air interface where the return pressure is measured. This is the air detector, and this is the line clamp, similar to our hemodialysis machine. And what we also have is, unlike the hemodialysis machine, which uses volumetric controlled ultrafiltration, this machine uses a gravimetric volume balance. That means that the machine has 4 scales. The scale with the yellow mark is the effluent scale, the scale with the white mark is the PBP or pre-blood pump scale, the scale with the green mark is the dialysate scale, and the scale with the purple mark is the replacement fluid scale. And these line guides enable us to thread the right fluid lines to the right scales. The machine also is able to tell us that its maintenance is due. This machine is saying that in the next 4 days it needs to get a preventive maintenance. But let's move forward, and here we have the first screen saying PrismaFlex system. I'm going to continue here, and now I have my screen on which I'm able to either view the therapies that are available or start my patient's treatment. Let's have a look at the therapies available. So we go to therapy info, and here we have, the machine says that it can do CRRT, which comprises slow continuous ultrafiltration, continuous veno-venous hemofiltration, continuous veno-venous hemodialysis, or the most complex of the lot, continuous veno-venous hemodiafiltration. So these are the therapies available, and now what I'm going to do is to show us the circuit diagrams of each of these therapies. So if I go to slow continuous ultrafiltration, the effluent pump will be used, as will the pre-blood pump fluid, which which will deliver the anticoagulation in this situation. If I want to do continuous venous hemofiltration, then the replacement fluid will come into use, and it may be delivered either pre-filter or post-filter. These 2 pinch clips enable the machine to deliver the fluid at the right point that is required. If I want continuous veno-venous hemodialysis, then the dialysate pump will come into action along with the effluent pump. And if I want to do continuous veno-venous hemodiafiltration, then all the pumps will be used at a given time. There's also a situation that we do not really need to, when we use this machine, memorize the specifications of the filter sets that we use. We can just go to the machine and check them out. So here we have the 2 possible sets, the M60 and the HF20, which are used in children. The M100 is used in adults. Now let's look at the specifications. We want to do CVVHDF and use an M60, and the machine itself is telling us that this is the blood flow range, this is the dialysate flow, the ultrafiltration and the patient fluid removal that we can set from this. This machine also has a barcode reader here which reads the barcode on the set that is loaded. So it detects which set is loaded, and it will also therefore ensure that the parameters which are being set do not exceed or fall below what is allowed by the machine in this situation. So I'm going to exit that info and I'm going to start entering the parameters for my patient. So I select new patient and I'm going to enter the patient's name. Enter. The machine is now asking me what is the patient's weight. It was 15 kilos. So I'm going to enter that, and it wants to know the hematocrit. I'm going to accept this value. Now what the machine has is certain information about the patient. It knows the patient's name, it knows the patient's weight, and it knows the hematocrit. Using this information, the machine will calculate a parameter called the filtration fraction, which is essential for the life of the filter set. And in order to do that, we know that the filtration fraction is equal to the effluent volume divided by the plasma water flow. And the plasma water flow is blood flow into 1 minus hematocrit. These calculations will be done by the machine for us. We don't need to remember. All we need to do is to confirm that we are happy with what we have entered. Now the machine allows us to choose the modality of treatment, the same screen I showed you earlier. We can choose SCUF, we can choose CVVH, CVVHD or CVVHDF. I'm going to select the most complicated CVVHDF today because that means this is a therapy in which all the systems and all the pumps are activated. If I want to switch to one of the simpler therapies, all I have to do is to make the flow of one of the pumps 0 and the machine will switch back automatically to the therapy selected. So the machine has now gone to the anticoagulation screen and I can choose what form of anticoagulation I want. It could be no anticoagulation, it could be systemic heparin anticoagulation, or it could be regional citrate anticoagulation. Let's look at regional citrate anticoagulation today, and because our machine with the 8.2 software is capable of doing the calculations even for regional citrate itself, I'm going to select the internal citrate regional anticoagulation. That's what I have now. I can confirm here, and the machine is now telling me that what I'm going to do here is, if I choose regional citrate anticoagulation using the machine's own software, I have a situation in which I've got to use this fluid, RegioCit. It says here RegioCit, and this is the RegioCit bag with this orange label. This is a 5-liter bag. It has a sodium of 140 and it has citrate at a concentration of 18 millimoles per liter. The other fluids which are available are this bicarbonate based fluid called Prismasol BO, which contains 140 sodium, again a bicarbonate of about 30, but this fluid has calcium and magnesium and therefore cannot be used along with citrate. So when we use citrate, we want a fluid that does not have magnesium or calcium. So on the replacement fluid pump, I'm going to hang Bifossil. Bifossil has a lower bicarbonate of about 22. It also has a potassium of 4. It has a small amount of hydrogen phosphate and it has no calcium or magnesium. Right. So this is the last screen, and once I press continue from here, my parameters as regards the patient, the treatment selected and the anticoagulant are fixed. If I want to change, I can once back again go here to these soft keys, choose a different therapy, choose a different anticoagulation or even a different patient. I'm happy with what I've got, so I'm going to press continue, and now the machine is telling me that I can load my set. Since our patient weighs 15 kg, we're going to use an M60 set today. In India, there are 3 sets available. This is the M100 set, which is about 0.95 square meters and is used in adult treatments. And this is the HF20 set. It is a very tiny set used in neonates or infants weighing less than 10 kilos, and it has a surface area of just 0.2 square meters. But for today's therapy, I'm going to use the M60 set. So I take my M60 set. This is my M60 set unpacked. I'm going to hold it this way, and now I'm going to place it on the machine. That's locked in, and now I have got to fit my pressure pods this is the effluent pressure pod. I'm now going to fit in the dispatcher ring. This ensures that any stray currents are sent to drain and not to the patient. I'm going to fit my blood detector in there. And now I have two more pressure pods to fit in here. This is the access pressure pod. And this is the filter pressure pod. And this is my venous catcher. And I'm going to connect it to the return pressure line here. I place the line in the air detector, the line clamp, and then I need to hang this effluent bag from the effluent scale. So it's important that I pull the scale all the way out and then I hang the bag here. So I'm going to hang it, and during for the priming process I'm going to connect my return line to the effluent scale. So I connect the return line there, that's ready, and now I'm going to push my scale back in, and this click should be heard because that means that the sensor has now engaged. So I've loaded my set, I've connected my pressure pods, my return line, and I've connected my effluent. So now there's a button here, I'm going to press load and allow the machine to load the set. So my machine loaded the set, the barcode reader read the set, and it has confirmed that what I have loaded is an M60, that my therapy selected is continuous venovenous hemodiafiltration, and it's asking me to manually confirm the same, which I have done, and now I'm ready to load my treatment bags. So let's just sit on the PVP line. Let's do that. Whenever we load something on the scale, it's absolutely essential to ensure that we pull the scale out all the way and push it in so that the sensor engages. So, as I said earlier, the white line is the PVP line. So let's get hold of the white line. So we'll load this white line through its own line guard, take it down, and we will spike the bag. Normal saline on the priming hook, and I'm going to connect the arterial line and the effluent line with this Y connection to my priming fluid. So here goes. Now the green line is the dialysate line. The dialysate scale is green. and the purple scale is the replacement line. And I've loaded that. So bags all connected, the return line is connected, and the priming set is connected. Now the machine wants me to choose my anticoagulant. We said would be regional citrate, which needs to be neutralized with calcium. So I've got calcium gluconate. My machine is primed for calcium gluconate. So now I have to load a syringe with calcium gluconate, and I'm going to then deliver this calcium gluconate directly to the patient through this safe line, which will connect to the patient's central line. So I press auto down, and the syringe hatch will move downwards. I can place my syringe in its place. I'll open this plunger hatch, and now I'll press auto up. That's done. My syringe is loaded, and I press continue. So now the machine says press confirm to confirm that the syringe is loaded. I'm going to do that, and now the machine is ready for self-priming and self-testing. It's now waiting for the scales to stabilize, and now the machine has started the priming process. This priming process will take about 5 minutes to complete, and during that time all air will be removed from the entire circuit. So now the test is, the priming is well in progress. It takes usually 5 to 6 minutes to complete this process of priming, and now we're down to about 1 minute. Once the priming process is over, the machine will then perform a self-test of all its monitoring and alarm systems, which we will see in a minute. While the machine continues the last minute of priming, we could talk about this blood warmer which is placed on the left side of the machine. It's important to realize that these bags which deliver dialysate and replacement fluid, unlike the dialysate of a hemodialysis machine, are at room temperature. And in the AC atmosphere of intensive care units, this is likely to be about 20 to 22 degrees. So the bags will be delivering fluid at that temperature. When the bags deliver fluid at that temperature, dangerous hypothermia could occur in a patient, especially a small child, for which purpose we use a blood warmer. So the return line is placed into this warming cable, and we will set the blood warmer temperature here to more than 37 degrees, so that the blood returning to the patient at least is at the normal body temperature. So now the machine has completed the priming process and gone into the self-test. These black squares here will display for us the percentage of the test which is complete. It's now performing the blood leak detector test. Here, this is the blood leak detector. Once the test is completed, we will see a red light flashing on the top of the machine, and we can then go forward. So when the red light starts flashing at the top of the machine, it has completed its self-test. The test is okay, the set is okay, and we are ready to go forward. So I'm going to press the button that says continue. The machine is telling me that it can allow, with this filter set, a patient weight loss or gain of up to 200 ml over 3 hours, not a bigger error than that. If that were to happen, it would prompt us to discontinue the treatment and remove this set. I'm confirming that, and now I'm ready to do my settings for my patient. So the blood flow for this patient who weighs 15 kg should be between 2 to 4 ml per kg per hour. So I'm going to accept 50 over here. Now, under normal circumstances, in addition to blood flow, I should have been able to set the PBP pump rate, but I can't. The PBP pump rate has been set by default by the machine at 500 ml per hour, which is what happens when you choose the citrate, regional citrate anticoagulation. The citrate dose by default is 3 millimoles per liter of blood processed, and we can set that, we can reset that in the anticoagulation settings. For now, let's choose to set our replacement fluid, and let's choose to set our dialysate flow rates. Now, if we are going to deliver 2 liters per 1.73 meters squared per surface area per hour for this child who has a 0.64 meter squared body surface area, it comes to about 740 ml per hour. In adults, this corresponds to 30 ml per kg per hour. In children, because of the larger body surface area to weight ratio, it is different. 30 ml per kg per hour would come to 450, and that has already been exceeded by the PBP rate. So I'm going to go with 750 ml per hour, and I'm going to split the rate among my PBP fluid, my dialysate fluid, and my replacement fluid. So I'm going to set my dialysate fluid rate here, and it's been got highlighted, and now I'm going to raise it. So I'm going to keep a dialysate fluid rate of 200 ml per hour. I'm then going to set my replacement fluid, and I'm going to keep my replacement fluid at 150 ml per hour. Now what the machine has told me is that at this rate my filtration fraction is 26%. That's too high, so I'm going to drop my replacement fluid rate now. I'm going to bring my replacement fluid rate down a bit. So if I make it down to 100 ml per hour, my filtration fraction is 24%. That's okay, because my pre-dilution is also set at 83%. And I'm going to choose to remove some fluid from the patient. So I'm going to set that at around 1 ml per kg per hour, so 15 ml per hour. And now I'm going to confirm all these. So now I can set my citrate delivery rate in this. The citrate dose here that has been set is 3 millimoles per liter of blood. I'm going to change that. That's too high. That's what the machine is set by default. But I prefer to go based on the paper which was published about 10 years ago, I think by Profi, that I would like to have a rate of around 2 millimoles per liter of blood. So I'm going to change my citrate rate and get it down to 2. And with that, my PBP citrate has fallen from the original 500 to about 333. So I'm going to accept that now, and the machine tells me that the estimated patient citrate load will be about 4.3 millimoles per hour. I'm happy with that, so I'll continue. Here is my final setting of the machine. I've got my flow rates here. I can now change my flow rates. Initially the citrate rate was much higher, the citrate rate is now lower, so I can increase my replacement fluid now. I'm going to go to 150, and now my filtration fraction is still only 21%, so that's quite acceptable. Now I'm happy with that. I've got my citrate rates all set. My final settings on the machine are a blood flow of 50, the citrate delivery of 333 ml per hour, dialysate rate of 20 ml. My calcium rate has been set automatically. I'm going to aim for 100% neutralization of citrate by calcium, and the machine has decided that that means a syringe rate of 5.8 ml per hour. I'm satisfied with this, so I press continue, and now I'm ready to connect my patient. So what I've got to do is to disconnect the effluent line from here. I'm going to connect my effluent line to the effluent bag. I'm going to take off the return line from there, and I need to connect the return line to the patient. So let's imagine that this is the patient that we've connected it to. I've made sure that my PBP line is connected here, just where the blood exits the patient. I've disconnected the effluent line, I've connected it where it should be, and now I press continue, and the machine is asking me to do a final check that all my connections are okay, and then press the start button. So I pressed the start button, and the blood pump and the effluent pump have started. Here is my prescription on the main screen for me. The blood flow rate is 50 ml per minute. The PBP citrate is being delivered pre-filter from the PBP scale at 333 ml per hour. The dialysate at 200. My replacement fluid at 150. My calcium is going at 5.8 ml per hour. I can adjust that if I want. Let me go back to my prescription. The effluent is around 704 mils per hour. It's delivering a dose of 47 ml per kg per hour at a filtration fraction of 21% and an ultrafiltration rate of 29 ml per kg per hour. On the right hand side of my scale, it is measuring the pressures, the access pressure, the filter pressure from these two pressure pods, the effluent pressure from this pressure pod, and the return pressure from this air blood level over here. It also displays for me the transmembrane pressure and the filter drop pressure. The transmembrane pressure is the pressure between the blood compartment and the effluent compartment. It is being measured here, and it is a marker of how much ultrafiltration we are doing, the ultrafiltration rate, and also the filter status, while the filter drop pressure is the pressure that drops vertically across the filter. When the transmembrane pressure and the filter drop pressure are both increasing, it indicates that both clogging and clotting of the filter is occurring.